I'm Gary with Tennessee Stands, and welcome to our COVID dashboard. Here, we're going to be looking at some overall mortality data for the state of Tennessee. Again, all this data pulled from the Tennessee Department of Health and directly from the CDC. But some things that I think are critical that are interesting to take a look at. For one, you can see on the graph on the left, and I'll expand it here. Give me just a moment. On this graph in particular, you can see the difference between the actual number of deaths for every year in Tennessee and the expected number of deaths we had in that year. And in what we see here in 2017, 18, and 19, you can see that the expected number of deaths in Tennessee always gradually increases. And that the amount of actual or observed deaths is always just above or just below on average. I don't know. Who knows why? Who knows what's going on? But I find it interesting, and this comes directly from the CDC, that in 2020, we break the trend. And the CDC overall expects, as you can see represented in the dark blue, expects less people to die in the state of Tennessee than it did in the prior 3 years, or at least in the prior year. It breaks the trend of increasing, which I think is interesting because if you think about it, I'm not trying to tout a conspiracy here. I'm just saying, if you think about it, in recent history, that number always increases, and it makes sense. It should increase. Why? Because our population is aging. And our large population demographic, the boomer generation, as we call them, the boomers, are aging. And not only is a great portion of our population aging, but our population is growing. Tennessee is a growing state. A lot of people are moving here. So an increase in population and an aging population would naturally lead you to believe that in 2020, the trend would continue, and we would expect a greater amount of deaths in 2020 than we did in 2019. Well, according to the CDC, somehow we should expect less. Why? I don't know. Nonetheless, what happens is since they've expected less than previously, you can see the number of observed deaths is not only greater, which it is, but it's significantly greater than it typically would be. And so that is something to be concerned about. It's something to take a look at. But another thing to keep in mind is if you ask people on the street right now their interpretation of how many people are dying around them in Tennessee, I bet you some people would say twice as normal. Double what normally happens in Tennessee. Double the amount of people we expected to die in Tennessee are dying this year due to COVID-19. The truth of the matter is we're only seeing just shy of 10%, a 10% increase in overall deaths in Tennessee than we typically would. However, that 10% number could be slightly inflated due to the fact that for some interesting amount of variables, we have expected less people to die this year, even though our population is aging and growing. So that's something to take a look at. On the other graph, is I find quite interesting. If I can get there, as I expand this, you can see it shows you week to week, going back to the beginning of the year, the expected deaths in Tennessee, and you can see this yellow line as sort of a trend line on how many people should be dying in Tennessee throughout the year. Well, you can see March, April, May, June. Even though we were right in the middle of what we consider to be a global pandemic during those key months in the year when we were supposed to be seeing a lot of deaths and we were locking down, stay-at-home orders, wear a mask, close your business, we saw no excess deaths in those weeks, which is interesting to take a look at here. You can see that even with the COVID deaths represented in light blue, that during those months, we had right at the expected amount or just shy of the expected amount of people to die week to week in the state of Tennessee. Now, enter July, and you can see we crossed the threshold week to week of more people dying than expected. And as represented in the light blue, um, those are represented as COVID deaths. So we have seen an increase in death due to COVID-19 during these latter weeks of the year. However, it's worth noting that as you look through this chart, you can see that the number of expected deaths was also exceeded by all other deaths in some cases. So deaths not directly attributed to COVID-19. And you can also see, especially starting the week of, let's see, where are we right here? Come on, mouse work. The week of, our week ending Saturday, November 28th. So towards the end of November, you can see our overall rate of death in Tennessee sort of normalizing now, back to what we would typically expect. So again, which dispels the myth, in my opinion, that where we're seeing this rapid rise of cases, which is causing you to think that there's a rapid increase and an exponential increase in people dying around you in Tennessee. Not the case. Actually, the amount of people dying today in Tennessee is relatively close to what we would typically expect people to die from any cause of death in the state. So this is a really good graph to look at. This data lags behind a little bit, but as much as the data comes in, we keep this updated. So it's worth coming back and taking a look and seeing how these lines are trending. Thanks again for visiting our COVID dashboard. We're going to continue to help you to know the truth about COVID data.